Good morning, guys. I hope we're all sparkly. Today we're going to go through another case study just to highlight the complexities in making the diagnosis of testosterone deficiency and deciding whether testosterone replacement therapy is in the best interest of the person who has the symptoms. Now, these symptoms, the typical ones, low mood, tiredness, brain fog, low libido, there are lots of reasons why you might have these symptoms. So we always recommend doing a more comprehensive blood screen when you do your first diagnostic blood test, because more information, more power to effectively advise you as into what you should be doing. Because as we said before, testosterone deficiency is a diagnosis of exclusion. You don't want to jump on TRT when you don't need TRT. You need to be addressing all of the things that we talk about endlessly in order to earn your reward. Because testosterone is the base, but TRT can be the catalyst for change. But effort equals reward. The reward is an illusion. The effort is the reward. Boom. So let's talk about this patient. Late 40s, Indian origin. So we first think about, clearly he's going to have a vitamin D deficiency. Now, pretty much everybody has a vitamin D deficiency. Whenever I see a healthy vitamin D level, I say, are you supplementing? And they always say yes. So that yellow thing in the sky doesn't come out very often, dressed head to toe in clothes, and the vitamin D in food sources is limited for obvious reasons, over farming, etc, etc, etc. So we're fighting an uphill battle. So I recommended that this guy go on 4,000 IU of vitamin D3 alongside magnesium to help absorption. So we're already into the biochemistry. His kidney function was very normal, nothing to comment on there. His HbA1c, the measure of glucose control over 3 months, was optimal. Again, there is a higher risk of type 2 diabetes in men of Asian origin. So we get down to the liver function tests. Now, spidey senses are up, gamma GT elevated. So typically we think about, is this guy a boozer? Is he a chunky monkey? What's happening with the ALT? That's normal, that's reassuring. Has he got an illness, an acute illness? Because, as we've said before, you don't make the diagnosis of testosterone deficiency in somebody that's acutely unwell, because your testosterone level will drop. You do not rush to make the diagnosis of testosterone deficiency. So this guy, yep, he's a bit of a boozer. So this will be negatively impacting pretty much everything, including his testosterone levels, his sleep. Essentially, alcohol is disappointingly a poison, and it messes around with your neurotransmitters to make you calm, to subsequently make you anxious. So yeah, this guy needed to address his alcohol consumption, and this would obviously improve his sleep. So your sleep quality will be compromised as a result of alcohol. Oh, how unfair. So let's get down to the lipid profile. All pretty healthy, as we said before. Cholesterol is the precursor to pregnenolone, which cascades down to cortisol, aldosterone and testosterone. So you don't want a low cholesterol. You want a healthy cholesterol, and you want to remove inflammation that causes raised cholesterol, right? Hematinics. So what helps make up the red blood cells? So his ferritin level was elevated. Now again, we've noted that he's already a bit of a boozer. So that inflammatory process, boom, along with the gamma GT, there's acute inflammation going on here. His vitamin B12 level is borderline low, and his folate level is low. Now, what else does alcohol do? Well, it lowers your vitamin B levels. So recommended to this guy, obviously take a B complex, as well as cutting down, potentially stopping alcohol, because it's not good for you. Thyroid function test, very normal. Now, we know there's a bi-directional relationship between testosterone and thyroid. So, no, all good there. PSA, very normal. So we get down to the nitty gritty. First thing we look at is obviously their testosterone level. Now, he has a testosterone of 9.28 nanomole per litre. Now, the reference range on this lab report is 8.64 to 29. Now, that is absurd. As we said before, the reference range reflects the current population, not a healthy population. And as you guys know, we adhere to the BSSM guidelines, the British Society for Sexual Medicine guidelines, that say you can be considered for a trial of TRT with a testosterone of less than 12. So this guy, according to the guidelines, is a potential candidate for TRT. Now, if you've got a testosterone above 12, does that mean you're not a candidate? Well, no, but there's a bit of a grey area. And as I said before, testosterone deficiency is a diagnosis of exclusion, and we should be looking to address everything that might negatively impact your testosterone level, but it's more complicated than that. So again, speak to somebody that knows what they're talking about. So this guy's free testosterone, again, 0.203, reference range 0.198 to 0.619. Now again, this is absurd. Now the BSSM says less than 0.225, so yeah, he's a candidate. Now my guys on testosterone replacement therapy, they feel best with a free testosterone between 0.5 and 0.85. And the upper limit on this reference range is 0.619. Utterly absurd. So a GP is going to say, you're super physiological, you need to lower the dose. No, you don't. You need to speak to somebody that knows what they're talking about. So the negative consequences of raised testosterone, we've been over before. Raised hematocrit, dysregulation of the lipid profile, raised blood pressure, and psychological dysregulation, because testosterone's got that relationship with dopamine, and we've got testosterone and cortisol, remember? Yin, yang, balance, baby. We must have contrasting process to establish harmony, and that extends into absolutely everything. So yeah, this guy is definitely a candidate for TRT. So should he go on therapy? Well, let's go a little bit deeper. His luteinizing hormone and follicle stimulating hormone. So as we said before, luteinizing hormone is the hormone that tells the testicles to produce testosterone. In testosterone replacement therapy, or testosterone monotherapy, LH and FSH are suppressed. So that's why we use HCG to mimic luteinizing hormone. Now again, HCG does not show up as luteinizing hormone on a blood panel. How many times do I have to say that? So this guy's LH and FSH bang in the middle. So what type of hypogonadism has this guy got? Well, he's got a mixed picture, hasn't he? If he had a low LH and FSH, we'd be thinking about a secondary problem. If he had a high LH and FSH, we'd be thinking about a primary testicular problem. So this guy has a barn door mixed picture. So there's no obvious causation. His estradiol level, yeah, and again, pretty normal. It's not highlighting the fact he's got excess estradiol, even though he's a drinker with liver dysregulation and the aromatase enzyme is located in the liver. So yeah, it would make sense. And we know that estradiol is the primary hormone that tells the brain not to produce too much testosterone, because what is the HPG axis? It's a negative feedback loop. But no, it doesn't really say much. SHBG, very normal. So yeah, this guy's got a mixed hypogonadism. So he could be considered for TRT. Zinc level, 12, pretty low. So again, I recommended 30 milligrams of zinc picolinate alongside some magnesium. The magnesium doesn't really complement zinc, but it's a good thing to have to help facilitate sleep. Hematology, very normal. Hemoglobin, hematocrit, MCV, very normal. And again, you think about MCV in guys of Asian origin because you're thinking about thalassemia. And obviously there are lots of other causes for these issues that might be going on. So, should this guy go on testosterone replacement therapy? Well, we had a considered discussion. He's low enough to be considered. He's in his late 40s. Is stopping alcohol, improving his sleep, gonna optimize his levels? Well, he's not going to get up to a free T of 0.5, 0.85. So surely he must go on testosterone replacement therapy, because you need a level of 0.5 to 0.85 to feel good. Again, not quite that simple. We have lots of guys come for screening who have lower levels who feel absolutely fine. So again, we should be doing everything that we can be doing to optimizing our levels, but the decision to start therapy is always a considered one. So we weighed up the pros and the cons, and this guy is going to have a confirmatory total testosterone test. He's going to have some time to reflect, and when I speak to him again in about 4 weeks, we're going to make a more considered decision as into whether TRT is in his best interests. Now, obviously, it'll be in my interest to say yes, but I have integrity, so we are going to show due diligence and treat this guy properly. Because TRT can be life-changing. TRT can be the absolute golden ticket if you're willing to do what? Yeah, you guessed it. Go earn your reward.